One thing that they didn't quite focus on as much this time with Gorski, of course, is news about a potential vaccine. I'm sure you saw the comments from Fauci in this live Q&A with JAMA that 100 million doses by year end seems reasonable to him, couple 100 million by early 2021. And he did specifically zero in on Moderna, of course, phase 3 beginning the first week of July.
I thought it should have zeroed in on Regeneron. 2 weeks Regeneron starts. I know Regeneron's monoclonal antibodies, but I think that if we're going to have situations where the country is open, all right, and we're supposed to be able to get illness, Regeneron if you're going to be in the hospital, it's going to be intravenous. But most importantly, they've got the possibility of an outpatient injection cocktail. And what that would do is make it so if you got it, it's not a death sentence. I think that I know Dr. Fauci, some of the interview was like, listen, the vaccine may not last long enough. But the whole tone of the science is better start catching up to the rest of the country that's open for 2 weeks, 3 weeks, and we haven't seen the spike. So now we're starting to get a little more cynical and saying, hey, there's no spike. Now, I think a lot of the spike up north ended when you had social distancing and masks. I frankly don't understand the geography of how you could have all those people at the beach and not come down with a big spike of cases. But other than that, I regard an infinitesimal number in Texas. It's not happening. David, it's not happening.
Yeah. Well, at this, listen, there is, again, we're always learning more. What we know now is a lot more than we knew 2 months ago, very different perhaps than some of the things that we were told, Jim. At the same, but one of the key things is if you're outdoors, clearly the opportunity to actually get sick is a lot less. That said, we're still at 20,000 cases a day, and we're not really going down. I think that's an important point here. We're at 1.8 million, I think, overall, 106,000 deaths. I'm just checking the latest numbers. And we're not going down. I mean, we're plateauing at around 20,000, but Texas is going up. California is going up. Alabama is going up. North Carolina is going up. Tennessee is going up. Now, they're off small bases, and they're overall not that large of numbers, although some now are larger than actually New York's new caseload. Thankfully, New York in this area that we live in has come down dramatically, so that it is even below that, I think, of what Texas is adding on a daily basis in terms of new cases. But it's not completely going one way here, Jim.
You're right, but I am surprised. I don't detect. I would love to hear that there's a big social distancing movement and a big mask movement down there. I hear the opposite, which is that there are many people who are belittled if they wear masks. I hope that's not the case. Some of the stores, the national stores, obviously you're required to wear masks. But you're right, David. In Italy, there's still some spikes periodically. In Madrid, it seems gone. So you're right. You're absolutely right. I just feel like that there are many people in the South who are questioning the whole policy.